Welcome to Anatomy and Faith. Welcome to our channel where we love science and we love faith, and we're able to do science through the lens of Scripture, because we believe we are created in the image of a gracious, loving God. As Psalm 139:14 says, we are fearfully and wonderfully made. And we believe that science is possible because God exists. Having said that, today we're going to do the lumbar plexus. Okay? We're going to focus on the lumbar plexus. If you haven't seen the video on the brachial plexus, avail yourself to that. But today we hope to serve you the lumbar plexus. And so as a preamble, just like with the brachial plexus, I went ahead and drew a blueprint, and we're going to start labeling that and filling that in. We've got a little table of content, if you will. We're going to talk about the definition again of what a plexus is, the origin of the lumbar plexus. We're going to discover that there are 6 branches that make up the lumbar plexus. We'll talk a little bit about orientation. We're going to discover that 2 nerves arise from one lumbar vertebral level. We'll discover there are 2 nerves that arise from 2 lumbar vertebral levels. And there's 2 nerves that arise from 3 lumbar vertebral levels. And then we'll, if there's time, we'll talk about some pathologies and some clinical relevance. So that's kind of the flow of what we want to present tonight. Hopefully it'll be useful. And so let's go ahead and start labeling the lumbar plexus. Okay. So what is a plexus? A plexus is an intricate network of nerves that interconnect with each other, which originate at the spinal cord. And these plexuses, whether it's a cervical, brachial, lumbar, or sacral, distribute nerves to specific regions of the body that innervate muscle, skin, and articulations or joints. They supply both sensory and motor function to the muscles, and then also sensation to joints. So that, in a nutshell, is the definition of a plexus. Regarding the lumbar plexus, what is its origin? It originates from the anterior rami, or the ventral ramus, of nerve roots L1, L2, L3, L4, and in parentheses I got T12. Why? Because T12 gives a corresponding branch, and we'll allude to that. We'll talk about that briefly. What's really neat about the lumbar plexus is that it actually originates in a muscle, which is the psoas major muscle, which is the most powerful and important hip flexor. Okay? So we talked about the definition, we talked about origin. A couple of things that we will discover. We will discover that there are 6 main branches that make up the lumbar plexus. Okay? And then the orientation, we talked about that, the 2 nerves arising from different levels, and then we'll talk about some pathologies. So, and what we will also discover once we label the lumbar plexus is that 4 nerves will move lateral to the psoas major, 1 moves anterior to the psoas major, and 1 moves medial to the psoas major. Remember, we said it originates in that muscle. So, and we'll talk about that, we'll label that, and then we'll go ahead and get started and start filling in the actual plexus. Okay, so before we start labeling, we're going to use a mnemonic. We're going to use a mnemonic to help fill in the blank, and the mnemonic is I twice gobbled lobster on Friday. Okay, fine. The problem with that, or the challenge, is when a lobster is done, is prepared properly, there's a lot of butter and there's a lot of garlic, so we might have some chronic halitosis. And if you're going to see patients after you gobble that, you might want to twice gargle Listerine on Friday. I know it's a silly little mnemonic, but the thing is, you have the I twice, the G, the L, the O, and the F, and that's important. So, nice little way to memorize. I twice gobbled lobster on Friday, or you can say I twice gargled Listerine on Friday. So let's start labeling. The first one we want to do, don't let this is just for optics. The color, obviously this is not drawn to scale, and if you dissect a lumbar spine, you're with a cadaver, it doesn't look like this at all. This is just a little bit more flavorful optically. But we're going to start right here with T12. Okay, L1, L2, L3, L4. Now, just remember, L1, L2, L3, L4 is actually the lumbar plexus. We said that T12 gives a corresponding branch. It's very similar to when we did the brachial plexus. We talked about the phrenic nerve from C3, C4, C5, and we said 3C, C3, C4, C5 keeps the diaphragm alive. Not technically part of the brachial plexus, because the plexus starts from C5 down to T1. But because it gives a corresponding branch, we mention it. That's the same thing here. So T12. What is T12? Well, T12 gives off the subcostal nerve. The subcostal nerve, which is literally just below the 12th rib, okay, subcostal. And just as a freebie, this innervates the quadratus lumborum. Okay, just know that it is not part of the lumbar plexus. So what we're going to do here is we're going to start drawing some of these branches. And what I'm going to do to make some room, so just know that the subcostal nerve, okay, quadratus lumborum. In fact, let me just do this. We'll just put a QL for quadratus lumborum. Okay, we're going to draw the number 3, if you will. Just draw these branches a number 3. And we'll do it again. We're going to draw a number 3. We're just filling in this the boxes, okay? We're filling in this blueprint because we're going to end up with a beautiful mosaic of nerves. So the first one is called what? This one right here is your iliohypogastric nerve. Iliohypogastric nerve. And it has a contributing branch from T12, but L1 is the predominant one. So we're going to go iliohypogastric nerve, L1, T12. Okay. What's the next one? So that's the first eye in twice. Remember the mnemonic, eye twice, gobbled lobster on Friday. What's the second eye? And we will talk about these nerves individually a little bit later in the tutorial. Okay? The second one is going to be your ilioinguinal nerve. Ilioinguinal nerve. So that's your two eyes, iliohypogastric, ilioinguinal. This one, as you can see, comes from L1. So now we have two nerves from L1 and a corresponding branch from T12. Remember we said here two nerves arise from one lumbar vertebral level? Well, that's your iliohypogastric and your ilioinguinal. So those are your two eyes. Then the G. What is the G? The G right here is your genitofemoral nerve. Genitofemoral nerve. There's a L1 contributing branch and an L2. So we're going to write L1 and L2. Okay? So we have the iliohypogastric, we have the ilioinguinal, we have the genitofemoral nerve. Now we have the L. What is the L? The L is the lateral femoral cutaneous nerve. The lateral femoral cutaneous nerve. That one gets supplied by L2 as we travel along L2 and L3. L2 and L3. So now we have two levels, two nerves arising from two lumbar vertebral levels. The first one's L1 and a branch of T12 and L1, L1, L2, L2, L3. Lateral femoral cutaneous nerve. Okay, what do we have remaining? We're going to take another color. Let's do brown, and let's do, well, let's see here. Green, we can do green, and we can do dark blue. So what I'm going to do is I'm just going to draw a line straight from L2 down here. It's going to be an arrow. I'm just drawing an arrow. Okay? And that's the O. And the O is the obturator nerve. And then we'll draw another arrow, green. Please forgive my poor artistic work, but you get the point. We have another arrow, and that one is the femoral nerve. Okay? Now, they both come from root levels L2, L3, L4, but the obturator nerve comes from the anterior division, and the femoral nerve comes from the posterior division. And we see here, let me get the purple again, that we have L2, L3, L4. So we have L2, L3, and L4 for the obturator nerve, but we also have L2, L3, L4 for the femoral nerve. So that's exactly what we said down here. Two nerves arise from one lumbar vertebral level, iliohypogastric, ilioinguinal. We have two from two levels, the genitofemoral nerve and the lateral femoral cutaneous nerve. And then, of course, two from three levels, the obturator nerve and the femoral nerve. Now, we said that four of these nerves, so that's your six, that's your six. Iliohypogastric, ilioinguinal, genitofemoral, lateral femoral cutaneous, obturator femoral nerve. Four of them move lateral to the psoas major, one anterior and one medial. Which ones are anterior, which one is medial? And your little mnemonic is simply go. Go where? Go with me. Watch this. The G, there's only one G, which is your genitofemoral. So we have the genitofemoral nerve, and the only O is the obturator. Obturator nerve. The four of them, so the rest, so your iliohypogastric, your ilioinguinal, your lateral femoral cutaneous nerve, they're going to be moving lateral. So the anterior one is going to be your, I'm going to put an A here for anterior, your genitofemoral, and the obturator is going to be medial. So all of them are lateral except for the genitofemoral nerve is anterior, and the obturator goes medial to the psoas major. Okay? So that's important to know. Okay, we're going to start talking about the individual branches. So we'll start here with the iliohypogastric nerve. As you recall from the blueprint, the iliohypogastric nerve formed by the anterior rami or the ventral ramus of nerve root L1, and then a contributing branch of T12. So the iliohypogastric nerve gives off two branches, an anterior branch and a lateral branch. The anterior branch runs between the internal oblique muscle and the transverse abdominis. Super important, because the internal oblique muscle helps with flexing the spine. Okay, so it's very much active in range of motion, motor. The transverse abdominis, also a very important muscle, because the transverse abdominis, which is innervated by the iliohypogastric, assists the diaphragm during forced expiration. Okay, the forced expiration process, because it increases the intra-abdominal pressure. That's the transverse abdominis. Very important. The lateral branch will innervate the internal and external obliques. Okay? What about sensory? What does the iliohypogastric nerve do as far as sensory cutaneous? Internal and external obliques, the transverse abdominis, the posterior lateral gluteal skin. Posterior lateral gluteal skin, and the suprapubic skin region. The suprapubic skin region. Okay, that's sensory. What about motor? What does it do? Well, it has innervation of the internal and external obliques, the transverse abdominis, and the conjoined tendon. That is all the responsibility of the iliohypogastric nerve. Ilioinguinal. Remember, I twice gobble lobster on Friday, so we're just going to go through these. Ilioinguinal arises from the anterior or the ventral rami of L1, as we recalled right here, L1. Okay? Sensory, what does it do? Superior medial thigh and groin. Superior medial thigh and groin. The scrotum and the penis in males, the labia majora and the clitoris in females. Ilioinguinal nerve, super important. Motor, what does it do? Internal, external obliques. So a lot of abdominal innervation. Okay? So that's your two eyes, iliohypogastric, ilioinguinal. We continue with genitofemoral nerve. Arises from nerve roots L1 and 2. Okay? Sensory. Again, skin around the scrotum in males, mons pubis, labia majora in females. Also the medial upper anterior thigh, all sensory, cutaneous. What about motor? Very important. The genitofemoral nerve is responsible for elevating the testes in males and lowering the cremaster muscle. And with fight or flight, there's a danger, and the sympathetic nervous system kicks in. Not the parasympathetic, the sympathetic nervous system is in play. What does it do? It also will elevate. It can elevate the testicles in fight or flight, and also with very cold weather. Okay, when the weather is very cold, testicles like to be elevated, right, where it's a little bit more toasty in the lower abdominal cavity. That is the cremaster muscle. Okay, so that's motor function of the genitofemoral nerve. The lateral femoral cutaneous nerve arises from nerve root L2, L3. It is sensory only. Okay? Anterior lateral thigh, and the lower half of the buttocks. So split your buttocks in two longitudinally, lower half of the buttocks, lateral femoral cutaneous nerve. Iliohypogastric, ilioinguinal, genitofemoral nerve, and the lateral femoral cutaneous nerve. All right, folks, so we've done the first 4 branches. We're going to do 2 more. The obturator nerve, femoral nerve. obturator nerve arises from lumbar spine level L2, L3, L4. As we recall, right here, L2, L3, L4. Okay, and remember, it's the anterior rami. Okay. So what motor function does the obturator nerve have? Well, here's your mnemonic. Okay, let's do another color. Let's do another color. Let's go with purple. Here's your mnemonic. 3 ducks playing golf outside exclusively. Did I spell that right? Maybe. Maybe. Okay, so we're going to make this fun. 3 ducks playing golf outside exclusively. Well, what the obturator nerve does, it has an anterior division and a posterior division. Okay, just ANT for anterior, DIV for division, post, and okay, you get the point. So the 3 ducks playing golf outside exclusively, what does that mean? Well, these are your adductors, hence ducts. So the P is going to be for pectineus, the G is going to be gracilis, and outside exclusively is your obturator externus. But where do they fit into the anterior and posterior division? So the 3 ducts, the anterior division is going to be your adductor longus, adductor brevis, and the adductor magnus is in the posterior division. So adductor magnus in the posterior division. Okay? So those are your 3 ducts, adductors. What are adductors? If you're in the abduction position, you bring it back to the midline. You adduct. Playing, P, what is that? That's the pectineus. Pectineus in the anterior division. What's the G? The G is your gracilis. Gracilis. So we have 4 in the anterior division, and we got 1 more in the posterior division, and that is your obturator externus. Okay. However, we have a little caveat, because not all anatomy books will agree that the obturator nerve innervates the pectineus. So we have something else that's called the accessory obturator nerve, or AON. But in 60% of cadavers, anatomists tell us, the accessory obturator nerve is not even there. So the pectineus can be innervated by the obturator nerve and by the accessory obturator nerve, but more times than none, you'll see that the pectineus nerve is innervated by the femoral nerve, which we'll talk about next. Okay, so you have your 3 ducts playing golf outside exclusively, anterior division, adductor longus, adductor brevis, pectineus with the accessory obturator nerve, the gracilis, posterior division, adductor magnus, obturator externus. So this is all motor. Okay, motor. And what about sensory? Sensory mid-thigh, mid-knee. Sensory or cutaneous? Cutaneous, mid-thigh, and knee. Okay? Obturator nerve. Okay, last branch is the femoral nerve. Origin, we want to look back here. So it arises from nerve roots L2, L3, L4. Remember, it was the posterior division. The obturator nerve also came from L2, L3, L4, but anterior division. So this is the posterior division. Posterior division, but it is the ventral rami. Okay, very important to know. Okay, now let's talk motor function, and then we'll talk sensory. So motor function will start around the pelvis. What does the femoral nerve do? What does it innervate on the pelvis? There's 3 muscles. Okay? First one, psoas major. Second, psoas minor. And the iliacus. Psoas major, minor, iliacus, and these collectively are called the iliopsoas. So the psoas major, psoas minor, iliacus collectively are called the iliopsoas. That's over the pelvis. Okay, what about the thigh? What about over the thigh? Well, we have an anterior division. Gets complicated. Anterior, posterior, but it is what it is. Posterior division. And so the femoral nerve over the anterior position, we're going to use a little mnemonic, P-A-D-S, PADS. The only reason why I did PADS is because it means something. But the AD here is actually to remind us about anterior division. The only 2 muscles is your pectineus and your sartorius. Okay, the pectineus helps in adduction, flexion, internal rotation of the hip. The sartorius starts at the anterior superior iliac spine and runs diagonally down. It flexes the hip, externally rotates the hip, but it flexes the knee and internally rotates the knee. Super important muscle. Okay, so this AD is just anterior division, so it spells out PADS, the pectineus and the sartorius. And we talked about the pectineus, remember, with the obturator nerve, and said it was the accessory obturator nerve. So not all literature is 100% in consent with one another. Some say, no, it's the femoral nerve, but just be mindful of that. So anterior division, we have the PADS, pectineus, sartorius. What about the posterior division? What do they do? Everybody's heard of the quadriceps. Quadriceps femoris. Okay, quad meaning 4. What 4 muscles are innervated by the posterior division of the femoral nerve? Number 1, rectus femoris. Number 2, the vastus medialis obliquus, the VMO, we'll put here VMO. And then you have the vastus lateralis, and we have the vastus intermedius. Okay, these three, oh, that's terrible. That's better. These three are monoarticular. That means they only run over the hip. They come together into the patellar tendon, extend the knee. The rectus femoris is biarticular. So it flexes the hip and extends the knee. Powerful muscles, your quadriceps femoris. So again, rectus femoris is the only biarticular. These are monoarticular. Anterior division, pectineus sartorius, and then we've got the posterior division, the quadriceps femoris. So lots of muscles here. The iliopsoas, which is made up of the psoas major, minor, iliacus, pectineus sartorius, and the quadriceps muscles. Okay, so what about sensory? This was motor. What about sensory? Well, sensory, we also have an anterior division, and we have a, you guessed it, posterior division. Okay. Anterior division, we're going to use an acronym, and we're going to use the acronym AIM. Okay, A-I-M. Aim where? Aim higher. Aim wherever. Okay. The A just stands for the anterior division. It's just, we're just dropping that A because what happens is the anterior division will become the first I, intermediate and medial femoral cutaneous nerve. Okay? So the anterior division, what arises from that is the intermediate and medial femoral cutaneous nerve. All right. What about the posterior division? Well, let's use a different color. Let's go with, let's go with green. The posterior division, basically, it turns into the saphenous nerve. Okay, very important. The saphenous nerve, or saphenous, however you want to pronounce it. And what that does is it's sensory to the thigh, mid-thigh, knee, calf, foot, all medial. Medial, okay? The saphenous nerve. So, let's step back real quick. Femoral nerve arises from nerve roots L2, L3, L4, posterior division. Ventral rami, motor of the pelvis, psoas major, minor, iliacus, collectively iliopsoas. The thigh, anterior, posterior division. Pads, pectineus sartorius. Quadriceps femoris, which includes the rectus femoris, vastus medialis, lateralis intermediate. Sensory, anterior division will become, what arises from the anterior division is the intermediate and medial femoral cutaneous nerve. Posterior division, the saphenous nerve, which is sensory to the medial thigh, medial knee, calf, and foot. Okay, quite a bit of information there, but you can see here, guys, with pathology. So let's say there's a trauma to the femoral nerve, whether it's a tumor, a motor vehicle accident, any type of trauma that will that involves a femoral nerve. You can see all these muscles that could be affected. The hip muscles, you could have very weak quadriceps where you can't extend your knee. You can have problems with hip flexion, with external rotation. So lots of problems with a femoral nerve that is injured. That's true for the obturator nerve, any nerve in particular, but because the femoral nerve does quite a bit, an injury to the femoral nerve can be quite devastating, to say the least. So, we've talked about the subcostal nerve, which is innervating the quadratus lumborum, which is technically not part of the lumbar plexus, but it gives a contributing branch to the iliohypogastric, which was L1-T12. Ilioinguinal, L1. Genitofemoral, L1, L2. The lateral femoral cutaneous nerve, L2, and a branch from L3. Obturator nerve, femoral nerve, L2, L3, L4, but the obturator nerve from an anterior division and the femoral nerve a posterior division. Okay. All right, guys, just as an addendum, since we talked about the femoral nerve, just real quick, something about the femoral triangle. Let's just visit that just briefly. The femoral triangle right in the groin area. So if we draw that, we're just going to, again, don't worry about my drawings because it's pretty terrible. But this would be, this is of course lateral, this is medial. Okay? So the femoral triangle, the base right here is going to be your inguinal ligament. Okay? Your inguinal ligament, called the base. Your medial border is the medial aspect of the adductor longus, is the medial border. The lateral border is actually the medial border of the sartorius. And if you recall, we talked about the adductor longus. He's innervated by the obturator nerve and the sartorius muscle by the femoral nerve. So those are your borders, your inguinal ligament or the base on top. Okay, now when it comes to the femoral nerve, we'll draw that in black. So if here is the rest of the anatomy, the femoral nerve, and if this was a 3D presentation and you could take that inguinal ligament and pull it out, what happens is that the nerve runs behind it and it comes on down, okay? But it's most lateral, okay? So I'm going to put FN, femoral nerve is lateral. What's in the middle, what comes next or medial to that is the femoral artery, okay? The artery. And then over here you have the femoral vein. And so it actually spells V-A-N, van, but backwards. So what we need to know is that the femoral nerve is most lateral, then in the middle is the femoral artery, and then the femoral vein. And this is palpable. So if you take your index finger and long finger, you can put that in the groin area, and you can actually feel it pulsate. Okay, just like with the radial nerve, the radial artery, you can put that on the radial side, you can feel that pulsate. The dorsal side of your foot, the dorsal pedis, you can feel it. So there's areas in the body where you can feel that. Now, obviously that runs on down, but it's only the femoral artery and the vein that are surrounded by a sheath, okay, a femoral sheath to protect it, okay, because that's, you want protection. And so the femoral nerve is not part of that sheath. The inguinal ligament arises from the anterior superior iliac spine and goes down and it inserts here on the pubic tubercle. Okay, the lacunar ligament. Okay, so we have the medial border, the adductor longus, the lateral border, the sartorius, the inguinal ligament from the anterior superior iliac spine to the pubic tubercle of the lacunar ligament. But then we also have some muscles here if we want to know our geography. So the acronym here is I pray many prayers. True to anatomy and faith, I pray many prayers. So here you would have, in this area right there, I'll just draw an arrow, is the iliacus. Okay? Right here is going to be your psoas major. And then over here you have your medial is your pectineus. So I pray many prayers. I, iliacus. The P and the M, prayer many, is going to be your psoas major, not to be confused with psoas minor. That's why we put the A there, many. And then the pectineus. Okay, so that's just a very gross picture, an anatomy sketch of the femoral triangle. But just know that the femoral nerve, if you're going to take a test and they just ask you, geographically, where's the femoral nerve compared to, your femoral artery or your vein, it's going to be lateral. Okay? And then the muscles are the iliacus, psoas major, pectineus, inside this triangle, and then the borders, of course, longus, sartorius, and the inguinal ligament. Okay? And then your mnemonic is, I pray many prayers. Folks, I hope that was instructive. Hope you enjoyed that. If you did, you can like, you can subscribe. Hopefully here in the next several weeks, we'll do one on the sacral plexus. And that's going to be an interesting one as well. So thanks for watching. God bless. Till the next time.